Fixed full arch restoration. A fixed full arch restoration is used when all teeth are missing in the upper or lower jaw. This is an alternative treatment to the traditional full denture or implant overdenture, which rests on top of the gum tissue. In this procedure, multiple implants are placed. Based on your situation, your doctor will determine how many implants are appropriate for your case. The implants are typically left to heal for a few months. However, a temporary restoration may be delivered at the time or within 2 weeks of when your implants are placed. Exact timing will depend on the quality of the bone where the implant is placed. Following healing, impressions are taken and a custom fixed full arch restoration, manufactured by a dental laboratory, is seated onto the implants. The final restoration is secured to your implants with titanium alloy screws. This keeps the restoration stable and stationary while enabling your dentist to remove it should the need arise. If you are missing all of your teeth in either your upper or lower jaw, or in both jaws, a fixed restoration may be a great solution for you. Fixed restorations can provide the following advantages over traditional dentures and implant overdenture options. Look, feel, and perform more like your natural teeth. Help prevent further bone loss. Speak more naturally and with greater confidence. Eliminate the cost and mess of adhesives needed to hold teeth into place. Enable you to enjoy more of the foods you love without discomfort and frustration.